Hello, my name is Adrienne Moore. I am currently in the Master's of Science in Nursing program and will be presenting my research. The title of my presentation is A Local Clinic's Osteoporosis Screening Rate in Women 65 Years and Older. This is a complete overview of what I will be presenting today, including the purpose, objectives, methods, population findings, and discussion. So what is osteoporosis? To make it simple, it is the skeletal disease that allows the deterioration of bone tissue as well as bone mass that precipitates bone deficiencies and the risk of fractures. Of all the metabolic bone diseases, including rickets, osteomalacia, Paget's disease, and a few others, osteoporosis is the most prevalent and widely known, especially during the process of aging and menopause. Women have an exceedingly higher risk of 15.4% compared to the 4.3% of men. 71% of fractures related to osteoporosis occur in women. This is especially due to the reduction of estrogen after menopause. 50% of these women will experience a fracture. 12.3 million people in the U.S. who are 50 and older have osteoporosis, most unknowingly because it is an asymptomatic disease. The United States Preventative Task Force, a panel of experts that are involved in prevention and evidence-based medicine, recommends screening for osteoporosis to prevent fractures in women who are 65 years and older. They have determined that there is a moderate improvement in preventing fractures, which is implemented through bone density testing. Approximately 73 to 79% of women who were between 65 and 85 years of age reported having this screening in 2016. The primary objective is to compare the screening rates of osteoporosis in women 65 years and older at a rural Arkansas clinic to that of the national average that align with the recommendations for bone measurement testing from the USPTF. The study conducted will promote awareness for the significance of osteoporosis screenings. With the approval of the IRB, or Institutional Review Board, a retrospective chart review was conducted through 50 patient charts in the EMR, or electronic medical record, through a rural Arkansas clinic. Data included age, sex, and race that was collected. Charts that were reviewed were only female patients aged 65 years and older. Of the patients reviewed, an International Classification of Disease Code, or an ICD-10, of Z13.820 was needed. This code means that an encounter for the screening of osteoporosis was completed. Males and women under the age of 65 were excluded. In this study, it was found in this particular clinic that only 42% of women were being screened within these guidelines compared to the national average of 73 to 79%. 91% of these women were Caucasian. So here is a demonstration of the comparison of the local clinic and the national average. Here is the local clinic at 42%, and here is the national average of 73 to 79%. This Arkansas clinic was found to be significantly lower in average screenings compared to national rates. The importance of screenings is to prevent fractures, to reduce disability and complications of fractures in older age. Osteoporosis is an avoidable disease that can be treated through lifestyle modifications and pharmacological methods. This screening is so important because half of all postmenopausal women will experience a fracture in their lifetime. Ways that healthcare providers can be astute in completing osteoporosis screenings is a support tool that can be utilized in the EMR. This can reduce the risk of fractures by predicting when screenings need to be implemented based on age. Hopefully, through these significant findings, healthcare providers will be educated on the importance of osteoporosis screenings to prevent fractures in the future.